Good morning, good afternoon, or good evening, depending on what time you're actually opening up this email or watching this video. I'd like to just take a moment and thank you for the opportunity to serve as your 39th president of the ASMBS. It was great to see everyone this year at the annual meeting in National Harbor. We had over 2,500 attendees and over 80 individual exhibitors that were at our meeting. And just know that if you weren't there, you were missed. And we look forward to seeing you either at our upcoming weekend meeting in Louisville or our annual meeting next year in my hometown in San Antonio. I'd like to bring to light the theme that I had for this coming year. The theme is No One Left Behind. And that came to me primarily as part of my military background with the idea that we leave no fallen soldier behind. And I would just say that knowing that in the last couple of years, our surgical practices and programs have been suffering based on the volume decrease that we know exists, I felt like it was time that we acknowledge that. And so what I would say is no one left behind means we're not going to leave our surgeons behind. We're not going to leave our integrated health members behind. We're not going to leave our industry partners behind. But more importantly than anything, we're not going to leave our patients behind. And so with that knowledge, that is going to be what we push forward this year. I have some initiatives that I looked put forward, and we'll start out with the obesity education in medical schools, as well as nursing schools and PA schools. I would say that our frontline folks who are treating patients with this disease of obesity, we all understand that obesity isn't really being taught in any of these areas. And we had a summit this last year, the Obesity Summit, which was a reinvigoration from the summit that was started by Dr. John Morton many, many years ago. And it morphed into something a little bit bigger. And we were very excited about that. We had over 40 different organizations that came together at the Obesity Summit this last year, in addition to many of our industry partners who were there. The two groups that were missing, unfortunately, were the insurers as well as government. But I could tell you both of them wanted to be there. Unfortunately, the insurers had a hold on their travel. This was very closely timed to the United Healthcare CEO being shot, and there was a moratorium put on travel for government officials. But I'll get to that in just a moment about our government officials and our work. In addition, so at that summit, what was determined was that obesity education was lacking in all of these areas. And that was already an initiative I wanted to work on, but it was really good to know that that is something that the group at large understood, and we're going to work and create a task force that'll be cross collaboration with many of these other organizations. We're also going to work with SWORD to improve our guideline releases as well, put them in a unified form. So that's a big plan we have, as well as ramping up the social media that goes along with SWORD. We're actually, the third initiative is to continue the summit. The summit was such a great success. We will plan to have another summit coming up in the spring. And then lastly, but not least, is really I want to elevate our organizational impact and improve the perception and image we have of surgery. I think that there's just not enough out there that shows the compassionate caregivers that we are as metabolic and bariatric surgeons. And so I'd like to see that improve going forward. Another initiative that came into light just recently is working with Surgeon. We have a collaboration with them, and they're going to be working on creating a within their app an area for the ASMBS. And so that will be a member benefit to you. It's a no cost to you. It's an additional way for us to share and continue to collaborate through a different platform. And then lastly, I kind of alluded to a moment ago, was we had a meeting with CMS very recently. So we finished the annual meeting and we hit the ground running within just about a week. We already were meeting with CMS. And the exciting part of that is we're working towards trying to adjust and improve the national coverage determination so that it truly reflects our ASMBS IFSO guidelines. And so that first meeting went really, really well. And with that in place, we've actually already got our second meeting with an additional group at CMS coming up in the next couple of weeks. So I want to say thank you to you all for this opportunity and for this privilege. And I will tell you that we haven't stopped. We've been going since the meeting, and every day we're working for you. I'd really love to get your input if you have any questions. If you're passionate about wanting to be a part of anything that we're doing, please send an email to asmbspresident@asmbs.org. And that way, that is a monitored email that we can follow. And I would love to find those individuals who are interested in being on task forces, individuals who want to be assigned to committees, who really want to put their passion where we can all work together for one another. So again, thank you so much. I hope you all have a beautiful day, and I look forward to seeing you all soon.